For me, I think big picture wise, it was interesting to be involved in a project that looked at the exposome. So moving away from kind of these single exposures and single outcomes, because the environment doesn't exist in a vacuum. All these things are kind of combining together.
Exposures don't exist in isolation. You're not just exposed to one aspect of air pollution. You're not just exposed to, obesity. You're not just exposed to poor diet. It's a complex situation that has personal factors, things that maybe people can do themselves, but there are also a lot of societal factors that contribute to all those exposures. Think about things like the food environment that is important. So the complexity of that and trying to look at that as a whole, a holistic approach, if you will, I think that's something that we'll take forward to our future projects.
So the life course approach, that means that really have to consider things one step after the others to understand why people change their health or their social trajectories at different time points, and what can we do about it, and when we can potentially have the more opportunity to do something, is really to understand that we can no longer consider that we can live at the expense of the environment, and it's even public health or healthcare should really consider the environment in the outset, in understanding that in every health policy that we develop, we need to also understand the environmental impact and how you have to make sure that it's also sustainable from the environmental point of view.
One of the main factors that we found again and again to be associated with cardiometabolic outcomes was air pollution. And we observed that over the years air pollution decreased in most European countries, but still we found associations with cardiometabolic health. So although it has gone down, we need to work harder to get it down even more, because we still find these associations with cardiometabolic health.
It was also interesting to first off see that we were finding harmful associations at very low levels of air pollution, even below all of the air quality guidelines, but then trying to find ways, personal approaches to try to mitigate or offset some of these associations. So in my research, finding that individuals with higher diet quality maybe don't suffer the same strength of association as individuals with lower diet quality.
Context matters. So there are things that we see if we compare different European cities or locations that are the same between the cohorts, which is important because we need to understand general processes that are happening for everyone. And then there are things that are specific to certain contexts that are different between cities. We see that between France and the Netherlands already and between other cohorts. And so that's also important to know. So for policymakers, I think it's important to understand, okay, there are a couple of things that we need to do, maybe at a European or an international level, maybe there are things at a national level. You need to also take into account the local context and sort of target your policies. So it's a combination of that sort of bigger picture with the local picture that keeps coming up in various projects.
And something that was also standing out a lot is that we found a lot of geographical differences between different environmental factors and cardiometabolic disease. So many of the outcomes really depended on where we did the study, in which country, but even within regions in countries we found geographical differences. So it really stood out that location was very, very important.
It becomes more and more evident towards the end of the project, but also the socio-economic factors are something that are really having an impact there.
We are working with environmental exposures, one of them air pollution, and this changes quite a lot according to socioeconomic status, but this is different as well in different settings, so it's not the same pattern in all the different countries.
We found different associations between environmental exposures and depression, like for example exposure to green in the environment had a negative association with depression. So the more green in your environment, the less depression we saw in older adults.
But I think a key finding is is Ana Suarez's paper on environmental exposures and blood pressure, where she really looked at a whole range of environmental exposures and how they relate to blood pressure in childhood and adolescence and early adulthood. And one of her main findings is that temperature and humidity are quite important for blood pressure in children. And the reason why I think maybe that paper is important is that it really shows, it has a lot of aspects that I think are important for LongITools, looking at the various exposures, looking at the different life stages, which is something that really is key to the work that we do. So childhood, adolescence and adulthood. And also because the outcome, blood pressure, is quite important. We know that if children have higher blood pressure at a young age, they're more likely to have a higher blood pressure at older ages, which we know is a risk factor for diseases. I guess one of the other things maybe scientifically that I really enjoyed, and I think the same goes for you, is the new data that we've created in terms of the metabolomics. So both in the Eden cohort and in the Generation R cohort, new data were created looking at metabolomic profiles in children at various ages. One of the cool things that we found there is, we observed, okay, humidity and temperature are associated with blood pressure in children, but then we could go on, thanks to the new data, and saying, why? What happens in the body that links humidity and temperature to blood pressure? And we actually found that there are certain levels of certain compounds in the blood that explain that association. And that is, in my eyes, it may sound a little bit biological or a little bit technical, but in fact, what it's important for is knowing that and understanding that helps us detect early those children that are at risk of later consequences of exposure to higher temperatures and more humidity. So
in this project, we often talk about windows of opportunity for prevention, etc. Many of our results show that the trajectories of cardiometabolic health starts very early in life, and the environmental factors can have an impact very early in life. So to me, for policymakers, they should be aware of the importance of this window, the first 1,000 days or so, to make some efforts to prevent cardiometabolic disease or to promote good health in life.